Hello friends, welcome to the channel Dewdear Academy. So in this video I am discussing Nclex RN questions and the topic is related with Addison's disease. So I will be discussing some of the questions related to this topic, Addison's disease. So please all of you watch this video full so that you will get the complete idea of this condition, Addison's disease. So the first question is, when teaching a client newly diagnosed with primary Addison's disease, the nurse should explain that the disease result from. Options are insufficient secretion of growth hormone, dysfunction of hypothalamic pituitary. Third option is idiopathic atrophy of the adrenal gland, and fourth option is over secretion of adrenal medulla. So here in this question, the question is, when teaching a client newly diagnosed with primary Addison's disease. So this is the key term that you have to note. What is primary Addison's disease? The patient is newly diagnosed with primary Addison's disease. So what the nurse should explain regarding this disease, or how this disease comes or result from. The options given is regarding the growth hormone, insufficient secretion of growth hormone, then dysfunction of hypothalamic pituitary, then idiopathic atrophy of the adrenal gland, and fourth option is over secretion of adrenal medulla. So in this question we know that this is the condition that is related with adrenal gland. Addison's disease means Addison's disease is the condition that is related with adrenal gland. Adrenal gland, we know it is a two small glands which are located on the top of your kidney. Two small glands that are located on the top of your kidney, and we will call this gland as life-saving gland. Adrenal gland is also known as life-saving gland. And this gland is having outer cortex, and it is having inner medulla portion. So outer cortex and there is inner medulla. So outer cortex is forming 80% of this gland and inner medulla is forming 20% of this gland. And outer cortex is producing the hormones. Outer cortex is producing the hormones, mineralocorticoids. It is producing mineralocorticoids, then glucocorticoids and gonadocorticoids. Mineralocorticoids, glucocorticoids and gonadocorticoids. So these are the three hormones or steroid hormones which is secreted. Okay. Then regarding this inner medulla they are secreting catecholamines. It is secreting catecholamines, and it include epinephrine, then norepinephrine and dopamine. So epinephrine, norepinephrine and dopamine. These are the three catecholamines which is produced by this adrenal medulla. And outer cortex is producing mineralocorticoids, mainly aldosterone, then glucocorticoids, mainly cortisol, and gonadocorticoids that include androgens. So these are the three steroid hormones which is secreted by outer cortex. So what is then Addison's disease? If there is hyposecretion of these adrenal cortex hormones, hyposecretion of these adrenal cortex hormones, that is known as Addison's disease. Hyposecretion of adrenal cortex hormones. Hyposecretion of adrenal cortex hormones gives or it causes Addison's disease. Okay. So even if the term is indicating actually what happens here is there will be deficiency. There is not getting addition, but there is getting less amount or hyposecretion or deficient or absent. Okay, that is known as Addison's disease. The hormones are getting deficient in Addison's disease. Clear? So we will also call it as adrenal cortex insufficiency. Addison's disease can be also known as adrenal cortex insufficiency. Now our question here is, what is if there is primary Addison's disease, what does it indicates? That is our question. So we know that this Addison's disease, it can be divided into two, that is primary and secondary. Okay, secondary. So Addison's disease can be primary and secondary. Okay, primary Addison's disease is directly, it is due to the impairment of adrenal gland. Okay, this is due to impairment of adrenal gland. Primary Addison's disease is due to the impairment of adrenal gland, and secondary Addison's disease is due to impairment of pituitary or hypothalamus. Okay, this is due to impairment of pituitary or hypothalamus. So this is the difference that you should understand when you are studying this Addison's disease and the classification primary and secondary. So if you know this knowledge, you are able to answer this question. When teaching this client newly diagnosed with primary Addison's disease, so what does it indicate? That what does the nurse should explain that the disease result from? So whether it is first option is insufficient secretion of growth hormone. Insufficient secretion of growth hormone, that is the first option. So what actually happens if there is insufficient secretion of growth hormone? It is causing dwarfism or growth delay. Okay, if there is insufficient secretion of growth hormone, that is leading or that is causing dwarfism. Then the second option given here is dysfunction of hypothalamic pituitary. Dysfunction of hypothalamic pituitary. We have already discussed that is not primary Addison's disease. If there is dysfunction of hypothalamus or pituitary, that is causing secondary Addison's disease. So this one is secondary Addison's disease. It is not primary Addison's disease. Okay, this is causing secondary, or we can also call it as tertiary, secondary or tertiary Addison's disease. Then option 3 is idiopathic atrophy of the adrenal gland. Idiopathic atrophy of the adrenal gland, that is the option. So what is primary Addison's disease? If there is impairment of adrenal gland. Okay, impairment of the adrenal gland, that is mainly the causes can be autoimmune destruction of the adrenal gland. That is the main cause of primary. Main cause is autoimmune destruction. Autoimmune destruction is the main cause of this primary Addison's disease. So that can lead to this atrophy of the adrenal gland. So if there is atrophy of the adrenal gland, that is causing primary Addison's disease. Okay. Then the fourth option given here is oversecretion of adrenal medulla. Oversecretion of adrenal medulla. This is causing a condition that is known as pheochromocytoma. Pheochromocytoma. If there is oversecretion of adrenal medulla, that is causing this condition pheochromocytoma. There is increased production of catecholamines. We have already discussed the medulla, inner medulla, in the which is releasing this catecholamines like epinephrine, norepinephrine and dopamine. So if there is excess secretion of these hormones, catecholamines, that is causing the condition known as pheochromocytoma. So that is not related with Addison's disease. So with this explanation of the answers, now it is clear that option C is the correct answer, that is idiopathic atrophy of the adrenal gland. Okay, the primary Addison's disease is mainly caused by the problems related with the impairment of the adrenal gland, which can be autoimmune destruction of the adrenal gland, that is leading to this atrophy of adrenal gland. So idiopathic atrophy of the adrenal gland is the correct answer. So correct answer here is option C. In Addison's disease, I hope this is clear to you. So thank you.